Yes, my friend, thank you for coming. Thank you for choosing us.
Thank you.
Can you please tell me how you find us, how you choose to come to Turkey for this operation?
I was just Googling varicocele
Yeah.
operations, and I think I found you through that. So I found like your YouTube channel where you show your specific technique, and that's why I got interested in it, because it seems that the type of technique that is usually done at home doesn't remove the veins and therefore higher chance of recurrence. And like most people, I want to only have this done once.
So was your first time you begin to deal with this subject, or did you have any information? How can you?
In the past, I knew I had a varicocele for about 6 years.
Okay.
And then originally I was given the option of embolization.
Okay.
So I tried that.
Yeah.
And they did attempt to do an embolization, but when they were trying to do the procedure, they said my veins were too complex, so they aborted and they did not try. So then I just left it for a year, hoping it would go away. Obviously it did not, so I was basically putting it off, and then I decided I need to...
So embolization was not a choice for you, you were looking for the surgery, and you understand that microsurgery is better.
Yes.
And when you deal a little more in detail, you understand there is a recurrence rate, and we are working to decrease the recurrence rate, to improve the technique to decrease the recurrence rate. It's very interesting. When you open the papers, the literature, it says if you use microscope, success is 95-97%, which is not true. It's true for maybe true for these guys who did this study in the United States, and they described the test technique, and I see their pictures that they leave only one artery and one lymphatic, and they separated all the veins, everything, but it's not possible in every patient and for every doctor. It takes time. And there is a very high risk to injure the artery and to injure the lymphatic. And if you injure lymphatic, hydrocele will be formed. If you injure the artery, testis atrophy will be formed. So this technique is very difficult and most of the time impossible to perform. I was trying to do that way. I was using microscope, but still my recurrence rate was high. And I was surprised why it is written in the literature I have to be 95% successful. I'm using the microscope, but using microscope is just, magnifies the tissue. It doesn't do some magic. You have to deal with these vessels, and in some patients it's difficult, in some patients it's a little more easy. So I try to improve the technique, and when I talk with the vascular surgeons, they said, remove. I said, what's that? Remove it. We do it like this. We have to remove the vein. I said, oh, is it possible? Because when you learn something in some way, it's very difficult to change the way you learn. And it took for me time and experience. Once I was trying to remove everything, just the small veins, big veins, but I injured some arteries. And this is not a very pleasant situation. And then nowadays I am taking out the big prominent veins, and there are some maybe little tiny veins remaining. If I do them in the classic way of ligation, and sometimes there is bigger vein, but just next to the artery. I try to remove it, bleeding happens, I stop. Then I don't want to leave behind any potential tube. So I will ask for you to translate this to English. So I ligate it in many parts to finish this vein. How can you say in English this? How can you tell this? Not to leave behind any potential vessel.
I think exactly as you described. Like if you leave the vein, there's always the possibility that there will be recurrence and then blood will start flowing again. But if you ligate it in multiple places, even if one ligation opened up, you still have many others.
Yeah, I think this is the artery, this is the vein, okay?
Mm-hmm.
They ligate it, but this part is still present.
Mm-hmm.
Blood comes here, stops here, and it is assumed that the coagulation will happen. But if there is a little tiny branch, it continues from this branch, and when the blood doesn't stop, it will not coagulate.
Mm-hmm.
When I ligate it once, I decrease the length of the vein, but still there is a risk it may come here to the second ligation, first ligation, second ligation. It can come here, find the branch, continue its journey.
Mm-hmm.
So make another ligation. So it come here, try to find a branch, make another ligation here.
Mm-hmm.
By this way, I decrease the chambers, decrease the volume of the chambers.
Yeah.
I mean, so it works very nicely. How was the operation day and the afterwards for you?
The operation day was fine. I've never had a general anaesthetic before, so I didn't know what to expect, but it was really no problem. I was just, remember I was rolled into the OR,
Yeah.
and then nothing,
Yeah,
and then
thanks.
wake up, and it seems like magic that
Yeah.
that's happened. And
Yeah.
an hour and a half. is
How
passed.
about the pain after operation and now?
Pain after operation was not very bad. Like, I would describe it more as a bit of an ache, a bit
Yeah.
of discomfort, but not very painful.
Okay.
And then now is three days later, and yeah, it's a little bit uncomfortable, but it's
Yeah,
not
you are
painful.
operated Thursday,
Yeah,
and today is
Saturday, Sunday,
Monday.
yeah.
So for Friday, first day, Saturday, second day, Sunday, third day. It's fourth day
4
now,
days, yeah.
and you
Yeah.
will go. You will fly back today, right?
Yes, this
So,
afternoon.
do you think it is confident enough? It is good enough to have a back flight at the fourth day after the operation?
In my case, I think yes, but everyone's different. So
Yeah.
if someone had more pain, it would be more sensible to stay. But in
Yeah.
my case, yes.
Yeah, actually, I ask people to spare to Turkey a week
Mhm.
or 6 days at least. And the first day, if we do the operation, they will have 5 days. This is more safe.
Yeah.
In your case, we were lucky. If you had big swelling with bleeding or some complication, it would be a little more difficult. But I did many cases like this, and I must touch to the wood, but there is nothing big complication after varicocele operations. That's why it is doable overseas.
Mhm.
So, thank you again for coming, sharing your ideas, thoughts with us.
Thank you.
And do you recommend our center?
So far, yeah, and I'll let you know in 4 months when. we
Yeah,
see
this
how
is
it's
an
going.
important part. Now, after the recovery takes a month. And at that month, I don't want you to do any real exercise. Just live a normal life, stationary life.
Mhm.
And then after a month, you can start doing some exercises without increasing the abdominal pressure.
Mhm.
Just don't strain.
Yeah.
After 3 months, we will give you some supplements. You will use them, and then you will do a Doppler ultrasonography test and the sperm count.
Mhm.
And if in this Doppler, which I see now, everything is finished nicely, but if it also confirms this varicocele is over, I will let you start the exercises that you want, anything, but always be careful. Don't push yourself initially too hard.
Yeah.
Just step by step, you can start the exercises too.
Okay.
Yeah, other than that, for the foods, we have nothing special, but don't be constipated as much as possible.
Okay.
Because I don't want strain. This strain is
Yeah.
the worst enemy for me. Yes, sports is always a little tricky, but your case is good. I think you can perform, but we have to have controls with the Doppler ultrasonography. And maybe if you do a little more exercise, I will ask for another Doppler ultrasonography after 6 months, 1 year. We will we will be in contact. We will follow up like this.
Okay, sounds
Okay.
good.
Thank you for
Thank
coming.
you very much.